We all know that smoking is bad for our health. It increases the risk of serious medical problems like heart, lung and vascular diseases, not to mention things like lung, throat and esophageal cancers. The number of people who smoke in the UK has fallen a lot over the years. Back in the old days, of course, most of us sparked up all over the place. Trains, buses, planes, pubs and restaurants. Even the cinemas are ashtrays between the seats.
Bond. James Bond.
These days, of course, smoking is a complete no-no. If you smoke tobacco, you're much more likely to have a bad outcome from hip surgery. Anything from a heart attack or stroke to wound healing problems are all things that can happen after surgery anyway, but if you smoke, the risks go up dramatically. What about vaping? Well, many ex-smokers have switched to vaping, and there is some evidence that it's safer than smoking tobacco, at least in terms of reducing the risks of serious health problems that I mentioned earlier. Does it reduce the risk when it comes to hip surgery though? Let's have a look. Vaping is associated with poor bone healing, which is not what you want if you've just had a hip replacement. It might increase the risk of loosening and failing. Vaping also increases your blood pressure and can damage the lungs. These things could increase the risk of having a heart attack, a stroke or a chest infection. How do we know that vaping is the problem though? People who vape tend to have more medical problems anyway. Vaping is associated with lifestyle factors such as not doing much exercise, being overweight and not eating well. All of these things are associated with worse surgical outcomes anyway. So it might not just be the vaping that causes the increased risks. Even so, if you are thinking about having a hip replacement, you should think very carefully about doing whatever you can to reduce the risks. Stop smoking or vaping. Lose some weight by cutting out the carbs and stopping boozing. I know it's not easy to be healthy when you're in pain, not sleeping properly and just, well, completely fed up. It's worth the effort though. Are you a smoker or vapor? Let me know what you think in the comments below. A problem shared is a problem halved, as they say. Thanks for watching. I'll see you next time.